Welcome to this cranial osteopathy session. What you are watching may appear simple, but there is a deeply intelligent conversation happening beneath the surface. So, in cranial osteopathy, we don't chase the symptoms, we listen to the body and ready to reveal. So, this is a gentle, non invasive approach that engages the primary respiratory mechanism. It's a subtle rhythmic motion that reflects the health and vitality of the entire system. So you will see little bit movement here, but make no mistake, change is happening. So what is cranial osteopathy? So cranial osteopathy is a refined branch of osteopathic medicine that focuses on the inherent motion of the craniosacral system, including the brain, spinal cord, cerebrospinal fluid, membrane, and cranial bones. This system expresses itself through the slow rhythmic pulses that trained hand can feel. There are not blood flow or breath, they are subtle, more functional. We call this motion the primary respiratory mechanism or PRM. Every bone, every membrane, every fluid in the body participates in this tide. And when the tide becomes restricted, it could be due to some trauma, stress, birth injuries, or some unresolved emotion. The body adapts. But over time, this adaptation can becoming dysfunctions. So here we are, what we are trying to do, like how we listen through touch. In cranial osteopathy, we places our hands gently at the occiput, sacrum, the frontal bone, or over the thoracic diaphragm and simply listen. The goal is not to force the movement but to feel where the movement is restricted, which we call key listening and global listening, through which we can palpate and figure it out that which area got restricted, where the tissues are held. So, where the system is locked, we have to find it out. When we find that, we offer a fulcrum, a anchor point around which the body can reorganize itself. So in osteopathy, we believe four things which we call osteopathic principle, like body is a unit, structure and function are linked, body can heal itself, and circulation is the key. So sometimes the patient may feel warmth, tingling, or deep relaxation. Sometimes they feel nothing, and that's okay too. These changes are often subtle, and it takes some time, and but it's very profound. Now I'm going to talk about why stillness matters, the still point. One of the most powerful phenomena in cranial osteopathy, which we call still point. It is a movement when the tide stops just for a few seconds or minute and everything becoming quiet. To an untrained eyes, it may look like nothing is happening, but to the nervous system, it's deeply reboot. So this is where the body often release long held tension, physical, emotion, or energetic. During a still point, patient often sight, twitch, or fall into a semi-sleep state, which we call hypnagogia. This state is not meditation; it is a quite blend of sympathetic and parasympathetic balance, often called the hypnagogia window, a doorway between alertness and sleep, where healing begins to surface. Cranial strain pattern, what we feel, every trauma leaves a trace, not just in the muscle or joint, but in fluid and fascia. As a practitioner, what we feel, patients who have this kind of issues, they have a patterns of cranial strain, like torsion, side bends, compression, or shears, especially at the sphenovascular synchondrosis, which we call SBS. It's a key junction in cranial motion. So this pattern may be related to birth trauma, dental procedure, slap injury, emotional stress, or post surgeries. So our job is not to correct them but to support the body's innate intelligence in resolving them. So body will heal itself. Sometimes the body needs only a little guidance, a moment of stillness, a sense of safety, and it will begin to realign itself. What we are trying to do over here, like visceral and emotional connection, visceral mobilization. So, cranial osteopathy doesn't work in isolation. What happens in the cranium affects the vagus nerve, the respiratory diaphragm, the pelvis floor, and even the visceral also. So, patient with digestive issue, breathing problem, or menstrual pain often shows restriction in the cranial field. Emotions live in the fascia too. So, a headache may be more than just a tight muscle, or it may be a story waiting to be heard. So, we do not need to always the story. We simply hold the space for it, and the tissue begins to speak. So, there is a general question. Sometimes patient also ask. Sometimes uh, students also ask, like, what patient feel during the session. You may notice that patient is becoming still, their breathing slows, their eyes move behind closed eyelid. So these are all signs that nervous system is entering a healing state. Not fight or flight response, but rest, digest and reorganize. So some feel lightness, some feel heavy, some feel emotional release, other just feel sleepy, and sometimes nothing is felt until hour or days later. So that's because that it doesn't mean that doesn't work or doesn't happen anything. So we have to understand that this kind of work doesn't just targeted muscles, it work with the central nervous system, the fluid body and the emotional field. Now I'm going to talk about the scientific basis and modern research. Cranial osteopathy has evolved over decades. So what was once purely about palpatory is now supported by modern imaging and neuroscience. Research soon changes in heart rate variability, vagal tone, cerebrospinal fluid dynamics, and even a structural balance following cranial work. Studies also have exposed its use in conditions like migraine, tension headache, TMJ dysfunction, post concussion syndrome, and infant colic. So, but more than the research, it is result that speak. Patient return because their body remains something subtle but powerful. Safety. So, as we move deeper into the session, the dialogue between practitioner and patient becoming quieter. You don't feel like we are interacting verbally with the patient. Whatever we have to feel, we just feel, and sometimes we just recheck if there is some changes in the body or not, but in a more profound way. So now my hands are not just feeling the bones or tissues, they are in contact with layer of history stored as tension, fluid shifts, and motion loss. Sometimes a single sacral hold reveals the entire body's story, from head injury to emotional loss. So sometimes the cranial base begins to shift subtly, as if the patient's system is remembering how to breathe again. It not just breathing through your lungs, but with your fluids. As the longer we stay in this presence, the more access we have to the long tide. Long tide is a term which we use a deeper rhythm that unfold at 2 to 3 cycles per minute. This is where we begins to feel the body not as anatomically but as field. So this is not mysticism. It is measurable and precisely and clinically. So if we are trained to feel it, then only we can feel the fulcrum and fluid body. So in this phase, I'm offering fulcrum not by position but by intention. So fulcrum is a point of stability in the body. Fulcrum help reorganize chaotic patterns into coherent motion. So when the trauma occurs, it might be physical or it might be emotional. It often creates some internal zones where fluid no longer moves freely, and this becoming the seed of dysfunction. So when we do diagnosis with key listening, global listening, and local listening, we try to find out these areas. Some osteopath called it energy cyst. So this becoming the seeds of dysfunction. But when a safe fulcrum is offered by my hand, my presence, the still point, the body gently recenter around that new stable reference. So we're trying to do that wherever we feel that there is something needed, our presence that helps the patient. So here the fluid body begins to synchronize with the larger rhythm of health. We feel warmth is coming back, motion becoming more harmonious, and the patient's system shifts from holding to releasing. The role of the practitioner, mainly holding the space for healing. At this point, I'm no longer trying to do anything. The body has taken over, and I'm simply accompanying it. So, this is the deepest art of cranial osteopathy, not doing but begin. It requires us as practitioner to cultivate stillness, naturality, and clarity. The clearer we are inside, the more deeply the patient system can trust us. We don't touch with the goal to fix, we touch to invite the body back its own wisdom. The principle of osteopathy, we already know that body can heal itself, function, structure are interrelated. So to keep all these things in mind, what we are doing, just try to not to fix, that is not our goal. We just touch to invite the body back to its own wisdom, because the truth is the body already knows how to heal. It is just needs safety, time, and the right invitation. Now the integration part, where the system starts to rebuild. Now the session is moving towards integration. We may feel the patient's body becoming heavier on the table, more grounded, more embodied. Fascial lines begins to reorient. The central nervous system down regulates. The breath returns softer and more rhythmic. Some of these changes will be felt immediately. Some will unfold hour or even days later as the system continues to process what was released during the session. So it is important to give the time to the body. We have just opened a window for healing, and the patient system will now decide how to use it. Beyond symptoms, the deeper purpose of our work, we don't treat cranial bones, we don't treat sinus or spinal segments, we treat the whole person, the totality of their physical, emotional, and energetic landscape. We start as relief from headaches or jaw pain, can evolve into something more profound. Better sleep, emotional release, a shift in posture, renewed sense of calmness, improved focus, and mental clarity. Because the body and brain are not separate. Every cranial rhythm echoes through the nervous system, the viscera, the breath, and even the emotional state. So this is what makes cranial osteopathy so powerful and so humbling and so unique. Reflections, the legacy of Sutherland and the future of cranial work. We stand on the shoulder of giants like Dr. William Sutherland, who first perceived motion in the cranial bones, Dr. Roland Baker, who taught us what health is never gone, it only wants to be acknowledged. Dr. Freeman, who showed us that this work is equally relevant for newborns and the elderly. And teachers like Dr. Stephen Sennett, who remind us what the heart of osteopathy lies in presence, not performance. So, cranial osteopathy continues to evolve with support from modern neuroscience, fluid dynamics, and clinical imaging, but the core remains the same, to listen with our hands and let health leads the way. Here I'm going to describe what I'm doing over here. Like, it's called suboccipital balancing, occipital hold and release. Here my hands are placed beneath the occiput, gently cradling the bone of the skull. This is one of the most foundational hold in cranial osteopathy. It allows me to engage with the cranial base, the foramen magnum, and the medulla oblongata, which regulates anatomical functions like heart rate, respiration, and digestion. Through this contact, I feel from tension in the suboccipital musculature, asymmetries in the cranial rhythmic impulses, and any sign of compression or strain around the occipitoatlantal junction. This hold often facilitates a still point, allowing the PRM to pause, reset, and return in a more balanced form. So, in the occipital release, the occiput forms the base of the skull, is articulate with atlas below and the temporal bone on the either side. It also joins with the sphenoid at the sphenobasilar synchondrosis, which is the core fulcrum of cranial motion. Because of this relationship, the occiput plays a key role in coordinating the movement of the entire craniosacral system. The occiput houses the foramen magnum, through which the brainstem, spinal cord, vertebral arteries, and cranial nerves are passes. So, this makes it one of the most sensitive and influential areas for both neurological regulation and autonomic function. So, the main core purpose of the occipital release in cranial osteopathy, the occipital release is used to decompress the cranial bone, cranial base, reduce strain on the reciprocal tension membrane system. It helps to improve venous and lymphatic drainage from the head. It supports vagal tone via the vagus nerve. It addresses the dysfunction in the SVS and OA joint, and it also helps to balance the sympathetic and parasympathetic relationship. So these release is specifically important in patients who has headache, migraine, TMJ dysfunction, degenerative complaints via vagal involvement, sleep disturbance, anxiety and chronic stress, post whistler or head injury, sometimes in infants with latching issues, colic or torticollis. So to perform this technique, we have to place our hand gently under the patient's head. The occiput resists in my palms. My fingers cuddle the lateral edges just medial to the mastoid processes, sometimes within the fifth fingers, lightly under the base. So here I am assessing the primary respiratory mechanism, specifically how the occiput moves into flexion and extension. In flexion, occiput moves posteriorly and inferiorly, flattening slightly against the table, and in extension, it moves anteriorly and superiorly, creating an arching lift away from the surface. In healthy patient, in health, this motion is smooth, symmetrical, and rhythmic, usually around 8 to 12 cycles per minute. In dysfunction, if there is some dysfunction, sometime I feel, or sometime anyone who ever practicing osteopathy can feel reduced amplitude, asymmetry, or even complete inertia, what we sometimes call a cranial bone or cranial base compression. So now how does it feels like? As I mentioned, gentle contact. I allow time for the bone to respond. Sometimes the system enters a still point, a therapeutic pause in the cranial rhythm. Sometimes I feel a softening, a warmth or release under the bone, and sometimes I sense deeper changes. Fluid begins to move, tissue tone shifts, or the entire head subtly reorients. So these changes are often felt throughout the body, not only the head, because the dural tube, which attaches from the occiput to the sacrum, begins to transmit that motion freely again. So the occipital region is also deeply tied to safety and survival. So here lies the reticular formation, the brain's filter between alertness and relaxation. So here is also where the vagus nerve exists. So governing digestion, heart rate, and emotional regulation. When this regain is compressed due to trauma, stress, or birth strain, the entire autonomic system can become disarranged or dysregulated. So releasing the occiput not only improves the biomechanics, it often calms the nervous system. Patient may cite fall asleep or describe a wave or calmness passing through them. This is the parasympathetic state returning. So the body enters in a space where healing become possible. So in infants, the technique is essential for who have feeding issues, colic and reflux, asymmetrical head shape, crying due to base compression post delivery. In adults, it can be a turning point for releasing chronic neck tension, improve sleep quality, reduce anxiety, enhancing vagal tone and gut brain balance. So, when you see a practitioner simply resting their hands under the head, remember they are not just holding the bone, they are listening to the cranial base, the nervous system, the fluid body, and the history of tension stored in those tissues. So the occiput is a doorway not just into the spine but into regulation, balance, and deep restoration. This is occipital release. This is the cranial osteopathy. We will discuss more about on some other chapter or other day with other patient. But it's a very subtle, gentle movement where we have to release these areas, and these are the important thing which we have to take care when we are releasing this kind of patient. Now let's talk about CV4 or compression of the fourth ventricle. It's a deeply restorative cranial osteopathic technique which was developed by Dr. William Sutherland. It is designed to influence the primary respiratory mechanism at the neurological core through the fluid dynamic, neural regulation, and rhythmic motion at the base of the brainstem. So the fourth ventricle, which is located between the cerebellum and brainstem, is a key area for cerebrospinal fluid production, autonomic regulation, and the coordination of multiple vital functions. And CB4 works by gently engaging this zone to invite a state of deep stillness where healing begins. So, what do you do in CB4? In CB4, we don't manipulate, we just facilitate by gently encouraging cranial extension and softly resisting the flexion. We support the system to enter in a still point, a pause in cranial rhythmic motion. So this stillness, it's not pathological, it's regenerative. Following the still point, the body's intrinsic rhythm often returns with greater balance, amplitude, and vitality. Another question is how can CB4 helps a patient? CB4 can be beneficial for patient who uh, like reducing the sympathetic overdrive, like calming anxiety, restlessness, and sleep issues. It can help to enhancing vagal tone, which is supporting digestion, heart rate variability, and emotional regulation. It also can help to improve cerebrospinal fluid flow, which aids to detoxification, nutrition exchanges, and pressure regulation within the CNS. It also helps to relieving pain and fatigue by helping the nervous system reset from chronic stress or trauma. Another thing, it can support recovery post injury, post concussion, or during state of burnout. It, many patients feel a shift they cannot describe, like uh, weightlifting or clarity in returning of its their nervous system remembering what safety feels like. So why is CV4 is important in cranial osteopathy? CV4 often considered as a gateway to the deeper tide, the long tide, the fluid body, and the midline. So it helps us access core vitality without force. It is specifically powerful when a patient's system is overwhelmed or fragmented or unable to down regulate on its own. So, in cranial work, we often say stillness is where the healing begins. Now, here we are going to release parietal. So, parietal release, releasing the vault. Here, I shift to the parietal bone, positioning my hand with gentle contact over the lateral skull vault. Parietal bones reflect the balance of the midline versus paired sutures. If motion here is asymmetrical or reduced, it may affect sinus drainage, auditory tube function, or general cranial expansion. I apply not force, just a supportive presence. Often as I wait, the bones begins to move outward, following their natural flexion and extension pattern. If I sense any vault compression or shearing strain, I allow the tissue to find a new neutral, restoring motion through the sagittal suture and parietal lines. So let's take a moment to focus on highly underappreciated yet deeply impactful part of cranial osteopathy, the parietal release. So parietal bone form the central vault of the cranium. These paired bones meet at the top of the head along with sagittal suture, and they articulate with the five other cranial bones including the frontal, occipital, sphenoid and temporal bones. Because of this numerous connection, any restriction in the parietal can lead to a global imbalance in the cranial motion and dural tension. So that's why it is important. So if you know the role of the parietal bones, you can understand why it is so important. So from a biomechanical perspective, the parietal bones reflect the motion of the cranial system, specifically in the flexion extension phase of the primary respiratory mechanism. During cranial flexion, the parietal externally rotate, they move laterally and slightly inferiorly, creating an expansive widening motion at the crown of the head. And during extension, they internally rotate, moving slightly medially and superiorly, so narrowing the cranial vault. Now we are going to talk about the frontal lift in cranial osteopathy, a deep reset for the emotional brain, sinus system, and anterior cranial base. So in cranial osteopathy, the frontal lift is more than a local release. It's a powerful tool for reorganize the anterior cranial base, calming the emotional centers of the brain and relieving pressure pattern that often go unnoticed but are deeply influential. So let's explore what actually happens when we engage the frontal bone through this technique, not through the force, but through respectful listening and subtle facilitation. So why we use the frontal lift? The frontal bone plays a central role in cranial motion. It has lots of attachment with the parietals, nasals, sphenoid, ethmoid, and even maxillary also, which makes it a bridge between midline motion and the facial structures. More than that, the frontal bone overlies the frontal lobe, prefrontal cortex, and the orbital pallets, home to centers for cognition, memory, decision making, and emotional regulation. In many patients, especially those under chronic stress, post trauma, or after head injuries, the frontal bone can become compressed, distorted, or energically stuck. So generally, we often see headache, especially frontal or behind the eyes, sinus congestion, and chronic upper respiratory tension, eye strain, or difficulty in focusing, sometimes poor sleep, mental fog, or emotional reactivity, autonomic imbalance, which begins stuck in sympathetic like fight or flight response. So frontal lift is our way to inviting this region to release and re-expand, not just physically but neurologically and emotionally. So what release during the frontal lift, what patients generally feel? So when we facilitate a frontal lift, several layers begin to shift. Number one, cranial bone decompression. One of the first changes we felt is the softening and lifting of the frontal bone away from the sphenoid and ethmoid. This reduced compression on the sphenofrontal and frontal ethmoid sutures, restoring better motion and cranial rhythmic impulses. As a result, the anterior cranium begins to breathe again, subtle but vital. Second, sinus drainage and pressure regulation. Like when we are doing this, there are some changes in frontal sinus and ethmoid sinus and the nasal cavity. Now we are going to discuss about spinobacillar synchondrosis and sphenoid dynamics, why we treat these patterns and how they can transform the body. In cranial osteopathy, one of the most important reason we assess and treat is the spinobacillar synchondrosis or SBS. This joint whether the sphenoids meet the occiput. This is not just a structural junction, it's a neurological and fluid fulcrum where patterns of tension, trauma, and adaptation often converge. So, when this junction becomes distorted, whether from birth strain, emotional stress, head trauma, or years of compensatory posture, the entire cranial rhythm can lose its harmony. And when this rhythm is disrupted, the body's ability to regulate itself, it might be neurological, hormonal or emotional, can suffer. So why do we treat the sphenoid? Because the sphenoid is the central for everything. So it influences the pituitary gland, which governs hormonal balance. It controls or it influences the optical pathways, which affect vision and sensory processes. It also affects the cranial nerves, controlling facial expression, jaw function, and balance. The sinus, orbits, and upper palate, all of which reflect cranial balance. And it sits at the crossroad of the autonomic nervous system, where tension can shape both perception and physiology. So, when the sphenoid is out of balance, it does not just affect the head, it affects how the entire body communicate, sense, and responds to life. So, what happens when we release the SBS strain? When we identify and release pattern like torsion, side bending, shear, or vertical distortion at the SBS, we are not just adjusting bones, we are restoring communication with the central nervous system. So the body responds in powerful ways, like headaches and jaw tension begins to release, vision clear, eye strain reduce, sinus drainage improves, relieving facial pressure, sleep depends, and mental clarity also returns. Anxiety got reduced because the nervous system can finally down regulate. Postural alignment also improve as the cranium and the sacrum re-established rhythmic connection. So these changes are not random, they are systematic because when the core fulcrum begins to move freely, the entire system begins to reorganize. So why is this so fundamental in cranial osteopathy? So because of the SBS represents more than just a junction, it reflects the deepest pattern of health or dysfunction. We often find chronic emotional patterns, long held physical trauma, or even unresolved energetic tension expressed here. But treating the SBS, we are not chasing symptoms, we are clearing the center so that everything else can realign. In many patients, just one or two good releases at the SBS can shift chronic migraine, reduce vertigo, TMJ dysfunction, emotional rigidity, chronic fatigue or overdrive, even unresolved pattern post concussion or dental trauma also. And this patient may not always understand what changed, but they often say, I feel clearer, I feel lighter, I finally feel myself again, I feel relaxed. So those are the things patient give a command after the therapy. Frontal and ethmoid release. So what happened when we walk here? When you release the frontal and ethmoid bones, we are not just affecting a local part of the skull, we are engaging one of the most complex and sensitive area of the cranial system. So this region is deeply connected to the central processing, emotional regulation and autonomic function. The frontal bone is a house of prefrontal cortex which plays a key role in decision making, emotional resilience and cognitive clarity. The ethmoid, which sits just beneath it, surrounds the olfactory nerves and interface with the nasal cavity, sinuses, and part of the vagus system through facial and dural connections. So, when there is a tension or restriction between this frontal and ethmoid bone, patient may present with like chronic sinus congestion, headache behind the eyes or forehead, eye strain or visual fatigue, emotional rigidity or mental fog, vagal imbalances like manifesting as poor digestion, anxiety, or irregulation of breathing. So when we release this area, several shifts begin to happen, like the frontal bone or frontal lobes relaxes, allowing the mind to shut down or slow down. Patients often feel more grounded, more clear, and less reactive. Sinus drainage improves, creating a sense of opening or and relief beneath the eyes and forehead. Another thing, the olfactory system reactivates, subtle improvement, small and rebalancing input of the limbic system. The dural membrane release, which is like reduction in strain on the reciprocal tension membrane and lowering pressure at the cranial base. So, and importantly, there is often a vagal response, a softening of the autonomic nervous system when breathe depends when breathe go more on deep digestion improvement and system drops into parasympathetic tone. Now let's talk about unwinding. It's a deep release from neck to abdomen. So unwinding is one of the most profound expression of the body's intelligence. So it's not a technique we impose, it's a process we support through presence, permission, and subtle engagement. When we unwind, especially from neck, chest, and abdomen, we are inviting the body to release stored tension, emotion, and protective patterns that it no longer needs to be held. So, this is not stretching, this is not a mobilization, this is the body's expressing itself through movement guided by its own internal rhythmic and history. Unwinding the neck is a meeting point of structure, sensation, and survival. So, through the neck, there are a couple of structure process. The vagus nerve, which regulates the parasympathetic tone, the carotid arteries feeding the brain, the cervical dura connected to the cervical base, and the emotional reflex arc where fear, guarding, or old trauma are often held. So when we begin to unwinding here, we don't pull, we listen with our hands, following the micro movement, little bit, tremors, and spirals, or even stillness of the body, which body generally offers. The head may starts to turn gently any side, or the neck may sink, tremble, or feels like it's floating. Sometimes there is a wave that travels into the thorax also. So as the neck unwinds, patients often describe a sense of lightness in the head or emotional release like deep exhale or even tears. softening of the jaw, shoulder, and spine. This is the common thing when we do these kind of things is coming out, and a sudden drop in parasympathetic calmness, where the nervous system finally letting go the hypervigilance. Unwinding the chest holds the heart, lungs, and emotional center. It is where people say they carry their stress, feel tightness, or experience shortness of breath, even in the absence of diseases. So when we listen to the chest, we engaging with the sternum, the costal attachment, and the diaphragm. The pericardium often threatens the tension, the rib cage, which reflects breath, mobility, and trauma, and the emotional field, grief, fear, or shame, often sits silently here. Unwinding in the chest may involve like subtle anterior posterior shifting, twisting, or pulsating movements. Sometimes we feel, sometimes an arching or lifting, like the body is recognizing its postural core. Patient may spontaneously take deep breaths, release tension they don't know they were holding, and this is often where the diaphragm softens, allowing the entire respiratory system to reintegrate. Now we're talking about unlocking the body's front line of defense and vitality. Here we are unwinding the clavicle. So clavicle is more than a structural bone. It's a bridge between axial and appendicular skeleton, connecting the sternum to the scapula and playing a key role in posture, respiration, and emotional release. So why do we unwind the clavicle? Because the tension where it reflects protective posturing like slouching, guarding the heart, respiratory restriction, especially during emotional stress, chronic issues with the sternocleidomastoid, scalene, and brachial plexus, facial drag from the thoracic inlet, impact lymphatic and venous return. So, what will happen during the release? So when we release the clavicle, a shift in the upper thoracic pressure, which we noticed, loosening of the first rib and thoracic inlet, it improves shoulder alignment and freedom in the neck, and often a sudden deepening of breath, like the lung find more space. Clavicular release sets the tone of the chest to open, both structurally and emotionally. Next, what we're going to do, we are going to unwind the sternum. The sternum holds emotion and mechanical significance. It is centered to the rib cage, directly connection to the diaphragm and pericardium and mediastinal fascia. Now here what we are trying to do is called hyoid bone unwinding, unlocking the voice of the body. The hyoid bone is generally overlooked in manual therapy, yet though it's playing a vital role for breathing, speaking, swallowing, and head and neck balance. When it becomes restricted, it could be due to some emotional holding, postural stress, trauma, or tension from the jaw and tongue. It can silently affect the entire upper body and autonomic nervous system. So unwinding the hyoid bone, it can helps to ease tension in the throat and jaw, improve voice quality, and reduce vocal fatigue. It supports deeper, more relaxed breathing, release neck stiffness, and improve head posture. And re-regulate vagal tone, which mainly calming the nervous system. So this release often leads to a spontaneous shift, a deeper voice, easier in swallowing, softness in the shoulder, and more grounded presence. Now what we are doing over here is called sternal release in osteopathy, or somatic emotional release. So what is sternal release? So the sternum or the breastbone is not only a structure which anchor your rib cage, but also a fascial and energetic gateway. So in osteopathy, the sternal region is seen as a key access point to the anterior mediastinum, pericardium, and upper thoracic fascia. So the structure, which is often involved in postural holding patterns, visceral restriction, and emotional tension. These are the structure which is involved in this kind of problems. So generally, what we noticed, like why the sternum hold emotional tension, there could be four reasons. One is fascial memory. So fascia records your any kind of physical or emotional trauma. So as we know, the sternum lies over your heart and lungs, which are the organ which is associated with grief, fear, and vulnerability. Neurovisceral convergences also, like this area innervated by vagus nerve, sympathetic chain, and intercostal nerves. So emotional stresses can somatize through these autonomic pathways. Another thing, like guarding reflex, emotional trauma may lead to chronic chest wall constriction or shielding the posture, flattened thoracic kyphosis, elevated ribs, and sternum restriction. So there are two techniques generally we do, like direct myofascial or indirect release. So our goal is to improve thoracic mobility and rib cage expansion, release fascial tension around the heart, thymus, and lungs area, stimulating parasympathetic tone via vagal influences, and trigger emotional discharges where previous trauma was held somatically. So while doing this treatment, patient may experience like deeper breathing, emotional response like sometimes tears, laughter, or a release for long held emotions, lightness in the chest, warmth or improved posture, and a couple of other sensation also, like calmness, and sometimes patient feel like sleepy. So those are the normal phenomenon which we got while releasing this. So when we release the sternum, we don't just mobilize the bone. We free the diaphragm, heart shack, and emotional around the chest. So this technique, done with deep sensitivity and presence, can open both physical movement and emotional flow, especially in patients dealing with trauma, grief, anxiety, post traumatic stress disorder, related chest tension. Here I am going to talk about something deeper than just muscle and joints. Something we often feel but we cannot always explain, the energy. So, in osteopathy, we believe that the body is not just a structure, it's a living, breathing field of motion, vibration, and energy. And sometimes physical pain is just the surface expansion of this deeper emotion or energetic blockage. So, through energy based osteopathy techniques, we use light touch, often no more than a few grams, to listen to the body's rhythm. We don't impose change, we invite the body to return to its balance. And yes, this often involves walking around the chakra system, the body's energetic centers. When these centers are blocked due to trauma, stress, or emotional suppression, the body compensates. So you might feel tightness in your chest and heaviness in your belly or a constant buzz in your head. So during a session, you may feel warmth, lightning, or even a wave of motion. So that's the energy shifting. So that's healing, not just physical but emotional and energetically. So osteopath does not treat disease; it supports the body's ability to heal itself, which is the principle of osteopathy. And sometimes that starts with silence, presence, and gentle touch. So healing begins when we listen to our body's questions and whisper. Now, when we say energy, we are not talking about anything mystical. We are refining to the body's own biological and neurological activity. The way tissue responds to stress, the way fascia held tension, and how the nervous system stores emotional patterns. So, our body is an interconnected system. Muscle, fascia, organ, and the brain communicate constantly. But when we face trauma, prolonged stress, or chronic pain, this flow of communication can get stuck. Certain areas may become restricted, not just physically, but in their energetic tone and responsiveness. So, through very gentle osteopathic touch, we engage with the body's natural rhythm, like the cranial rhythm or subtle fascial movement. When we hold and support these areas without forcing change, the body begins to self correct. This process is what we call energy shifting. You might feel warmth, movement, lightness, or even deep emotional release. So, that is your body letting go, remaining itself from the inside out. So, it's not a magic, it's your own autonomic nervous system resetting, your tissues rehydrating, and your fascia recognizing. So, as we come to the end of this journey, I want to take a moment to step back and look at the bigger picture. So, osteopathy is not just a technique, it's a philosophy, a way of understanding the body as a living, breathing, and self regulatory system. Every bone, every muscle, and every organ is in communicating with each other, and more importantly, every restriction, whatever restriction is there, whether it's a mechanical or it's a emotional or energetic, has a reason. Our role as osteopath is to listen deeply and not just to what is tightened or restricted, but to what our body is trying to express. We should focus on that part. So, in this video, we explore how cranial osteopathy, one of the most subtle yet profound forms of this work, can support patient with chronic pain, stress, and long-standing tension patterns. So, by assessing the body's primary respiratory mechanism, the cranial rhythm, and the deeper tides, we don't just work with the bones and tissues, we help the nervous system to regulate and release the fascia and the body remember how to heal. So, we are trying to facilitate our body's own healing mechanism. So, for patients living with chronic pain, often it's not just one area that needed treatment. It is entire system that needs safety, support, and reorganization. So that is what cranial osteopathy offers. It helps restore neurological balance, reactivities of fluid mobility, and facilitates deep parasympathetic system where healing naturally happens. So somewhere you are a patient seeking awareness or a practitioner looking deeper into this work. Remember, osteopathy begins within the presence, not with force, not with tools, but with quiet, intentional touch and deep respect for the integration of the human body. So thank you for watching. This video is I'm trying to make it as much resourceable with you. Feel free to share it, comment below, and connect with us if you need wants to know a little bit more. And end of the session, I'm gonna ask a couple of questions to my patient and his response. The self-watching brain. So when we are doing cranial osteopathy, there are a couple of areas we are focusing to settle it down. Like your prefrontal cortex is the thinking part of your brain. It always planning, analyzing, worrying. It keeps asking, is it safe? What will happen next? Did I mess up? Something like that. So now add in your anterior cingulate cortex or ACC. It is the emotional monitor which your inner world scanning for conflict or stress. And then we have deeper layer of the brain, what we call the second and third corticals. These layer compare, judge, and stay on high alert. They are constantly watching, collecting, reacting, even when it is not needed. So what happened in chronic pain or anxiety? Your brain is not healing; it's auditing everything, every single information which is not needed, every emotions also. And this constant mental noise keep your body from settling down. It resist actually. So that's also create the recovery little bit slower. So the cost of overthinking, when your brain is stuck in this loop, it loses its natural way to come down. So many people end up running to medication, especially opioids, but opioids don't fix the root. In fact, they often causes more pain over time, a condition called opioid induced hyperalgesia. So now you have more pain, more dependency and rest regulation. So what if the solution is not more force but less? Another thing which I'm going to discuss over here is called hypnagogia. Like right now you can see the patient is lying down on the bed. It's in the semi-conscious state where brains heal its own. So hypnagogia, there's a powerful state your brain enters just before sleep. It's called hypnagogia. So in this state, your thinking mind quiets down, the emotional brain becoming more active, and brain waves slow down into alpha and theta rhythms, and your conscious and subconscious start to blend. So this is where deep memories can rise, tension start to release, and healing begins. And this is the state we often reach in cranial osteopathy without medicine, without any struggling. Just stillness, just gentle touch and persistence. Another thing, your brain has its own pharmacy. Inside your anterior cingulate cortex, your anterior cingulate cortex can create some incredible chemicals like GABA receptors, like GABA aminobutyric acid. It's your body's natural calming chemical. When we activate this area through cranial work, GABA start blending with, which means like less anxiety and better sleep, more resilience without any drug. So when we are doing cranial osteopathy, we help your brain to remember it is safe. In cranial osteopathy, we don't force changes. We create the space where your brain and body remember how to feel safe. So we help calm the prefrontal judge, quiet the emotional alarm, reset your nervous rhythm, and let your body's chemistry to do the work. Sometimes healing does not come from the knowing more, it comes from the letting go of what your brain thinking is already knows, and when it lets go, it begins to heal. Now I'm going to try to awaken our patient. Let's see how much time it can take. Sometimes I intentionally give them 2 to 4 minutes time so that they should be on that hypnagogic state, so that their healing will be starts from there. It doesn't necessary that after doing the therapy all the patient will get a lot of relief or something. It can happen after a couple of hours or might be 1 or 2 days. So it's a natural process. It takes time. Sometimes patient feels sleepy. Sometimes they feel, if they have some emotional stress or something, that will sometime coming out. So we just give the time body to recover, and gradually it will come to its normal state. And sometimes patient gives some comments. Sometimes they give their experience, share their experience. As we came to the end of this session, you notice there are very little movement. So no techniques, no pressure, no manipulation, just stillness, just presence. And right now the patient is what we call a hypnagogic state, a gentle space between awaking and sleeping. In neuroscience, this is the bridge between alpha and theta brain waves. So the thinking mind, especially the prefrontal cortex, which is becoming a little bit softened, and the deeper system of the brain begins to recognize. So what is happening right now? When we enter in this space, the nervous system done something truly intelligent. It stopped reacting and start integrating. During cranial osteopathy, especially in unwinding, we are not forcing the change. We are supporting the release of long held patterns, physical, emotional, and even energetic. In this situation, the fascia begins to soften, and the cranial rhythm, your body's subtle tidal motion, it start resume again. The visceral and membranes adjust their tone, and underneath at it all, something very old and very intelligent wakens up. So we often forget that fascia is a sensory organ rich with receptors that store trauma, posture, protection, and emotion. So when we gently hold and listen, the body begins to unwind the stories it's begin holding. Sometimes those stories are muscular, sometimes there are emotion, sometimes there are just pattern the body learned to survive. But when the system feels safe, when there is no threat, no agenda, it lets go. So this is what energy osteopathy taps into. Not some mysterious force, but the field of tension, rhythm, and resonance that surrounds every cell. So inside the anterior singular cortex, your brain emotional filter. Sometimes powerful things are happening, like GABA aminobutyric acid receptors are activating. That is your brain natural calming chemical, which I told earlier also. So your internal pharmacy got activated. This is why patient often report feeling clear, lighter, and calmer after the session. Not because of we added something to the body, but because we helped it remember that balance feels like. What balance feels like. When you see the head is subtle tilt, or feel a warmth flow under your hands, if you are an osteopath or a student, or sense the breathing quantity or quality, so that's the body's intelligence returning. We call it unwinding, but really it is the nervous system which is reorienting itself back to safety. The sympathetic drive quiets, the parasympathetic tone depends, and often for the first time, In a long time, the body finally stopped bracing. So this is where the real work happens, not in doing but in the being. So we want or we wait, we don't interrupt the process, we just stay present and listening. Because sometimes healing is not about what we fix, it's all about what we allow.
जब स्लीप होता है तभी आता है। ये पोर्शन यहाँ से नीचे भी लगता है, बहुत अनकम्फर्टेबल लगता है। मुझे नहीं पता है, शायद आपने नोटिस किया होगा, मूवमेंट भी लगती है, ये नहीं करती। थोड़ा बहुत वैसा यहाँ फील होता है और ये ज़्यादा लगती है। तो कुछ नहीं, ऐसा ही है बस। सो गया ज़्यादा देर। कैसा फील होता है? Soothing, relax, very, but मतलब बहुत कुछ चल रहा था, पता नहीं क्या, मतलब ट्रीटमेंट चल रहा था, जाग रहा था, बट जागते जागते बहुत सारी थॉट्स ऐसे चल रही थी जैसे मैं लिविंग, मतलब उन थॉट्स के साथ में कहीं चल रहे हैं, कुछ 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 रिपीटेड बार 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 डिस्टर्ब टाइप हो सकता है। Next